Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free. This is Dr. Thomas Grove. Dr. Darrow's away with us today. Phone number here. Call us live. We'd love to chat with you. We're at 866-870-5752. 866-870-5752. Got another caller here. Love to chat with you here. We've got Jerry coming to us from Paramount. Jerry, how are you?
I'm good. Thank you very much.
What can I do for you this morning, sir?
I'm calling because my grandson, who's about to turn 21, has for now about 6 weeks been suffering lower back pain. And I've taken him to the hospital, to clinics, to massage people, to chiropractors and whatnot. And it doesn't seem to want to go away. And we've done MRIs, we've done X-rays, etc., and anti-inflammatory pain pills. It doesn't go away. So I thought maybe we could find out what to do next rather than that.
Yeah, absolutely. So you had all the imaging stuff done, the MRIs, didn't really find anything that was the potential cause of pain. Is that right?
No, they're saying it's a muscle strain, but I mean, we've been 6 weeks, so it seems like a long time for muscle pain.
Yeah, I agree. So again, not a whole lot of information that I have there, but when I hear cases like this, I really want to get my hands on that patient and do a proper physical exam and see where exactly that pain's coming from, right? So like you said, a muscle strain, those typically heal up pretty quick, right? So we think the reason for that is the blood supply to muscles is so great that blood, which naturally has, those components of PRP and stem cells, right, can actually heal that tissue up. So if something's not getting better, I've got other questions. I'm thinking maybe is there something going on the ligament level? Remember, so a ligament's going to be that piece of tissue that connects a bone to a bone, right? So again, all I can do here, bring in physical exam, and if we can elicit some of that pain with some provocative maneuvers, right? Do a proper physical exam, give you a little bit more information. But from what I'm hearing, don't go to a surgeon for this sort of thing, right?
Oh, no.
Yeah,
God,
if we've got pain locally, that's something that you really want to go conservative first.
He does a lot of weightlifting, so I'm sure that has something to do with it.
Oh, fantastic. Yeah, I'm all about the weightlifting. I'm a big proponent for that. Before med school, I spent 4 years as a strength conditioning coach for professional athletes internationally. Oh, wow. So I'm really, really big on holding on to good skeletal muscle. But yeah, once in a while, again, you might have an injury here or there. Pretty common mechanisms that we see there. So once we get you healed up, again, get good biomechanics back in terms of how you move. So hopefully you don't have the injury come back again in the future. But yeah, it's one of those things.
What part of town are you in? Because Paramount's in South LA.
Yeah, we're in West LA, and then the Brentwood area.
I get there.
Yeah.
Sweet. Okay, so I'll call your 800 number and let's go.
Perfect. We'd love to chat with you more. Looking forward to it. Jerry, thank you so much for your call. Excellent. So yeah, really common scenario that we see. I think I have maybe 5 or 6 cases like this. Younger guys, 20s, 30s, had an injury in the weight room and, just didn't go away, right? It's been a couple of weeks. I think one of the gentlemen, it was a couple of months, and pain just didn't get better, came in, and they're all doing great now. I mean, funny enough. But the issue is you got to pinpoint where you think those symptoms are coming from, right? Not to say that you can't have a big injury that needs a surgical intervention, but again, what we see with a proper physical exam is we don't think that a lot of these symptoms come from like a disc bulge. That's probably a more common thing that people say that they have. We've got so many great studies now looking at imaging people with no back pain. Same thing, entire spine, whether that's your mid back, it's your upper back, it's your neck. What they did is they did MRIs on patients with no pain whatsoever, and we found a lot of these, these issues, right? Things like stenosis, where the little hole where the spinal cord nerve root exits out of gets pinched down. A disc bulge, right? That kind of shock absorber between the backbones and neck bones kind of gets pushed out of the side. Be a disc herniation. So we see these on people who don't have active pain, and really what that should be telling us is this may just be a normal part of an aging spine. So they did find a correlation that as patients get older, we see more and more of these sort of issues. So when I see something like that on imaging, again, could that be the cause of somebody's pain? Certainly. But in my professional experience, it's very rare that it actually is the source of somebody's pain, right? Especially when you've got that kind of localized pain. Now, if you've got a true, nerve root issue, you've got what we call a mass effect. So there's like a mass, so there's something that's actually pinching down on a nerve root that can cause that nerve to kind of get out of whack, causes things like true weakness. So all of a sudden you can't walk, or if you've got, numbness, where all of a sudden you can't feel, part of your hand, things like that. That could be a sign that something like that is going on, right? You had a big car accident and you got a bone sticking out into the nerve. Certainly, right? It's a different scenario. That's definitely something that you want to have some surgery for to alleviate that pressure on the nerve root. But we just don't really see that happening for the majority of patients that are walking into our clinic. So again, very important to get a good physical exam. I'm just going to give that phone number out one more time for you guys. Give us a call live here. We're at 866-870-5752. 866-870-5752. And if you're interested in getting a free consult with our staff, not with Dr. Darrow or I, but with our staff, give us a call. We're at 800-300-9300. That's 800-300-9300. Check us out on our website. We're at www.jointrehab.com. www.jointrehab.com. Lots of great information on there, lots of great studies. We put lots of videos on there. So hopefully you can kind of ease your mind heading into this, right? People are really nervous sometimes about needle procedures and how it's going to be super painful. It's going to take all day. Again, we make you comfortable, making sure we're putting you in a position where you understand what's happening. Procedures themselves are much, much faster than people think. Once we get you laid down, cleaned up, depending on the body part I'm working on, it might take me a couple of seconds, might take me a minute or so to do an entire area, but it's a very fast procedure. You walk in, you get treated, and you walk out. You can go drive home, you can go right back to work. Doc and I, we like to inject ourselves anytime we've got any sort of musculoskeletal issue. You can inject it, go back to work, finish the day out, no problem. So it's one of those things that hopefully we can ease your mind a little bit. Check out those resources. Love to get you a little more comfortable. But we're talking about your musculoskeletal and orthopedic injuries here this morning, seeing how regenerative medicine might be an option for you. We use things like platelets and stem cells, which are the healing cells of the body, to help regenerate tissue that might be damaged, right? Whether we're talking about a joint. So if you've got, some knee pain, some hip pain, shoulder pain, again, any joint, little bones in the hands and the feet, wrists, the ankles. Again, we treat head to toe. Again, I've got tons and tons of formal training, learning how to inject the body under ultrasound guidance. So it's a very, very safe way to inject. I can be very, very specific in terms of where I want to actually put these products, right? What we're able to do there is we avoid things like blood vessels, avoiding things like big muscles, nerves, that kind of thing that would cause a lot more discomfort for the injection. So we find that we can make things a little more comfortable for the patient, be more specific in where we're trying to treat, and get better results for patients. Again, how we get platelets is going to be simple blood draw, spin that blood down in a centrifuge. Again, it takes a couple of minutes to prepare that. The way that we get stem cells is going to be through the bone marrow. So when you look this stuff up, bone marrows are a very rich source of your body's own stem cells. The way we do that, we numb up the back of the pelvis, so a couple little pokes to get you numbed up. Use a real small needle to actually extract some of that bone marrow. It just takes a couple of seconds once we actually get you set up. From there, again, we can inject those products straight into these areas that we think is causing whatever sort of injury, right, that we have, right? You've got a painful area. Very important that you get a good physical exam, hands on the patient, to try to figure out where you think that pain's coming from. I had a kind of an interesting case. This was about 2 weeks ago. I'd love to share with you guys. This is somebody who came in scheduled for knee replacement surgery. So I was like, oh man, I'm glad that we at least got to you before the surgery, right? Unfortunately with surgery, and once you do it, it's hard to rewind the clock. If people have damage from surgery, it's a little bit harder to get them relief. So this is somebody who did not have surgery yet, but they were scheduled for it. They went in, had an x-ray with an orthopedic surgeon, said, hey, you've got bone-on-bone arthritis. We need to replace that knee. This is all we have for you. So they came to us, physical exam. I wasn't really getting much of the knee pain. Again, she said she has some pain behind the knee, but really what she had going on was a hamstring strain. So the hamstring is a muscle right in the back of the leg. that kind of helps you flex the knee. Again, if you're in a standing position, kind of brings your heel towards your bottom. But that tendon, crosses that joint, certainly. So it's in the general area. And so she was thinking that that pain was just coming from the arthritis, which she did have arthritis. Again, on imaging, you can diagnose that based off of, how narrow or how wide that joint space is, what the bones actually look like. But remember, just because you have arthritis on imaging, that doesn't mean necessarily that that's where your pain's coming from. Again, it certainly can. But even if you did have the pain there, again, I'd try to educate you and let you know, hey, regenerative medicine might be an option for you in terms of regrowing that cartilage. But in this case, a joint replacement would have done anything for her, right? So her issue is actually on the back of the knee, totally outside of the joint, where the hamstring was. And again, the way that I figured that out was with a good physical exam. You got to put hands on patients. You got to touch. You got to figure out where that pain's coming from. Followed that up immediately with a diagnostic ultrasound. So right after the physical exam, I'll put the ultrasound on you. And what she had was a little split tear in that tendon. So she had a little tiny tear where that muscle attached to bone. And this is now about 2 or 3 weeks out, I think. She's doing fantastic. So again, just another one example of, doing a proper physical exam can get you a little bit closer to where you think that pain is coming from. So again, God forbid she would have had a joint replacement. She wouldn't have had any relief at all because her problem was completely outside of the joint. So that's kind of an interesting case there. But again, when we come in and she emailed me this morning asking about other body parts, that's a pretty common thing that happens is someone comes in for one body area and then we end up treating multiple body areas because they didn't even know that we treat that kind of stuff. So again, we treat head to toe. In the last few weeks, I've done TMJ, so jaw pain, all the way down to a pinky toe. So I inject the entire body, entire spine. Again, it's really important that you're going to providers that have the proper training, know what diagnostic ultrasound is, and they do this stuff regularly, right? Don't ever feel bad about asking someone, how many of these have you done in the last month or the last few months or last year? And if they've only done a handful, you take a little pause, right? We get told all the time, what our sort of treatment volume is, and we treat a lot of patients. This is something that we've got a lot of experience in this field. Never say that anyone's like the best or anything like that, but we do a lot, right? We want to make sure that you're in a position where you're feeling comfortable, right? Another interesting case I had this week was looking at a young hockey player who had a fall, kind of tucked his elbow close to his body, fell on that shoulder, and actually dislocated it, and then it popped back in. So I was getting him a couple of weeks after he had a shoulder dislocation. Those are fun to put back in too, by the way. So again, a lot of sports coverage. I spent about 8 years being one of the team docs for Division I colleges. So you see a lot of joints popping in and out on the field. So it's kind of fun to pop those back in. But after that now, you might have some pain or instability. Instability is going to be where that joint gets a little stretchier than we want it to be, which can mean for the patient that you're more likely to maybe have another joint dislocation, which is what happened to him. So he had a dislocation, and then it was a couple of, I think, days later, just literally picking up a hockey stick, just kind of bringing his arm out in front of him, and it popped out again. So pretty typical scenario. Again, he was kind of told, listen, we should go in and do surgery. You should tighten up that capsule with surgery. Might have to actually shave some of that bone off. And again, in my professional opinion, this is one of those cases that does really, really well with regenerative medicine. So we can actually go in and inject these areas that actually tighten up that entire capsule, which provides more stability to that joint. So you actually are more in a position where that joint's not going to pop out again, right? So it's one of those cases where, again, you don't necessarily have to have surgery. Anytime that joint gets dislocated, again, whether it's a finger, it's a toe, a shoulder, an elbow, all these sort of things. People do really well with this stuff once they get it treated, shortly or immediately after an injury like that, right? Gives you your function back. Because what we don't want is, you're living with this for 40 or 50 years and we could have fixed it right away, right? So anytime you have an injury like that, again, it's a really good indication to come in and at least get it looked at with us, right? I want to give that phone number out again. Give us a call live. We've got a couple minutes left here for the show. We're at 866-870-5752. 866-870-5752. You can talk to me right now. give us a call. We'll chat about your musculoskeletal injuries. Again, we'll give you a copy for free. We'll even pay the postage for you now. Dr. Darrow's book. That title is called Stem Cell and Platelet Therapy. Regenerate, don't operate. Again, number to call with us here, 866-870-5752. And if you're ready to come in for a consult, give us a call. You can speak with our office staff. Again, free consult, not with us, but with our staff. We're at 800-300-9300. That's 800-300-9300. But love to chat with you. Got a couple more minutes here left for the show. But I can chat again about another interesting case I had. This is about a month ago. I had a gentleman come in, and he had some hip pain. Did an MRI, and he had something called AVN. I don't know if you guys have ever heard of this before. It's called avascular necrosis. So this is a situation where the blood supply to the bone gets disrupted for some reason, right? Whether it's a traumatic injury or you had a little clot or something. And if the blood supply to a bone isn't, all the way there, then that bone can actually kind of die off or necrose, called necrosis. So avascular necrosis, meaning blood supply kind of gets choked off and that tissue starts to die. So the hip is a pretty common area for this, just because the blood supply isn't great to what we call the head, or which is part of the ball and the cup. Right? It's the ball component of that joint. And was told he needed to have surgery from his orthopedic surgeon, and ended up coming in and looking at us for some treatment. We'll continue that here in a moment. We do have a caller here. Got about 10 minutes left. We've got Linda coming to us from Torrance. Linda, how are you?
Hi, I'm good. Thank you. I wanted to, my daughter got a diagnosis this last week about her elbow, and I wanted to call in to find out if she's a candidate for this platelet type of stuff, because I would really like to keep her away from having surgery if at all possible.
Yeah, absolutely. What was going on with her elbow? Do you have a diagnosis yet?
Yes, I have couple little lines. Can I read them to you?
Yeah, of course, please.
Okay, hold on. Let me get that up. I had it up and then I turned it to call you. Hold on, please. All right. So it says the impression is a tendinopathy of the extensor tendon with superimposed partial tear at the attachment on the lateral humeral epicondyle, if I said that right.
Yep, that's it. So basically what's going on here is you've got where the muscles attached to bone, that's called the tendon. So you said maybe a little tendinopathy with a little tear, and that location is on, like you said, it's the lateral epicondyle, which is just kind of the outside of the elbow there. Again, yeah. The word for this, is called tennis elbow. Have you ever heard of that before?
Yes, I have.
Yep. So pretty common injury. So we see that. It's not really an injury of the elbow per se, even though it's the source of the pain. That's where the actual pain is being elicited from. But it's really more of an overuse injury from the wrist. So when that wrist tries to extend itself up over time, right? You think about like a backhand from a tennis player over and over and over again, that can cause some inflammation now of that tendon and where it attaches to bone. Yeah, so this is a very, very common. I get a couple of these a week that come in that we treat. We got a good success rate with that. But again, a lot of questions. Anytime I see a diagnosis, I always want to make sure I'm still doing a proper physical exam. And this is something I could actually show you on the ultrasound, which is pretty neat. So we can actually look at those muscle attachments on the bone, and we can see exactly where that tear is. So you've got a couple of little muscles that attach in that area. So again, even if you wanted to go ahead with treatment, really important that you're aiming where you're wanting to put that product. But this is certainly something I'd be very interested in seeing, but that's something that we definitely treat here every week.
So she had an MRI. Is that something that we could have transferred to you guys to look at, or you would need to do something else to look at it?
Nope, that's all we'd need. Yep. So again, if you've got the imaging, I just say bring your report in, bring the CD in, and we'll actually go through it together. And again, for an issue like this, they can actually get better definition through that musculoskeletal ultrasound, which I'm the one who's actually doing those diagnostics. So we'll actually scan you in real time, and I'll show you on the screen exactly where we think that problem is coming from. So if you have the imaging, certainly bring it in. We'd love to have that be a piece of the puzzle. This is something that we can definitely pick up on ultrasound.
So this is something that's a platelet therapy like you guys do?
Yeah, absolutely. Yep. Yep. Again, it's an overuse injury. A lot of reasons why we think this injury happens and it doesn't heal necessarily quickly on its own. Could be, poor blood supply to that area. Or could just be a really big tear in that area. Regardless, this is something that does really well with regenerative medicine. So we'd bring you in, we'd get you a treatment. And fingers crossed, we get you better with one. Sometimes you need multiple rounds of treatment. Again, it just depends on how your body responds. And what we do is bring you back in 2 weeks, and we'd reassess to see how that pain is, do another physical exam, take a look at that ultrasound. And if you're healed up, and you're back to where you need to be.
Awesome. So I just need to call the office?
That's it. Yep, give us a call. That number is 800-300-9300.
90. Oh, good. I can remember that. Okay. Thank you so much.
Linda, thank you so much for the call. Looking forward to getting you some help.
Okay. Thank you.
Thank you so much.
Bye.
But again, what we're looking at here is inflammation in musculoskeletal tissue. We inject platelets, we inject stem cells into these areas, and this tissue can heal itself up. So pretty straightforward in terms of the elementary version of how this works. In reality, there's a lot of different things going on a cellular level. Cells talk to one another to actually bring in more healing factors, turn on what we call nascent, which are sleeping stem cells all over our body. Again, we've got these healing cells everywhere, but how they know where to get to where they need to go is going to be based off of cell signaling. That's called a paracrine effect. Just a fancy term for saying, hey, one cell over here talks to another cell over here, says, hey, come over here. We need you to come over and try to heal this tissue up. So there's a lot of cell-to-cell communication, which is a part of that healing process. But it's really amazing. I wish I could take credit and say, hey, I'm the guy. I'm the reason why you're healing up. But really, it's the cells, right? I mean, as long as we can put the cells where they need to heal, the cells are the ones doing the work for us, certainly. So, again, elbow pain is a very common thing that we see in the clinic. People do really well with that. I'll give that phone number out one more time. Got a couple more minutes left here, guys. 866-870-5752. Talk to us live. One more time. The phone number is 866-870-5752. Love to chat with you. Love to see you in the clinic. If you want to get a free consult with our staff, give us a shout. We're at 800-300-9300. That's 800-300-9300. So we were talking about a hockey player who had a shoulder dislocation. So got the joint popped back in. Unfortunately, had a second dislocation because we think typically it's because that joint gets a little too stretchy, right? So this is a case where gave him a treatment. Just talked to him yesterday, just a couple of days after his treatment. Feeling 100%, wants to get back to playing hockey again. So again, a really great success story there, but I had to encourage him, hey, you really got to take it easy. Again, we want to do a 2-week period where you're really laying off of any sort of vigorous physical activity to give yourself the best chance to properly heal. Because this stuff takes time, right? So we don't want to have you go right back to your sport too quickly. Real quick here, we got a little bit of time. Can we have Patrick from LA? Patrick, how are you?
Good. How are you?
Good. Got a couple minutes left. What can you help you with?
I have. I got diagnosed. I'm 56. My Achilles tendon is bulging.
Yeah.
And when they first looked at it, they said it's not hot to the touch. So they did a ultrasound and said it looks like it's just wear and tear over years, and it's sore, and that's something going to physical therapy for it. I didn't know if there's anything else that can be done to kind of mitigate. I have a minor pain there, but like I said, I'm doing physical therapy right now.
Yeah, absolutely. So Achilles tendon tears are a really common thing that we see here. So unless that thing is completely torn off the bone and retracted up through the calf, this is something that we definitely can take a look at. Very quick injection. Patrick, give us a call to get that consult scheduled, 800-300-9300. That's 800-300-9300. Love to talk to you more about this. Thank you guys so much for tuning in, and we will see you next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.